Good Monday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Our moment of gratitude today is dedicated to individuals who are living life the best way they can while practicing the 5 core actions. Specifically, we've seen several people having picnics in local parks lately. These picnics are made up of small groups in lawn chairs or on blankets, and they're spread out at least 6 feet away from each other, enjoying each other's company. This is a great way to socialize while not putting yourself or others at risk. We encourage folks who want to gather with friends and family to do so in a safe and thoughtful way like this. Maintain at least 6 feet of distance and wear a mask if that can't be done. Each media briefing from here on out, we are going to talk about ways that you can practically put the 5 core actions into play in your life. We know it might be awkward and uncomfortable to ask your loved ones to wear a mask or stand 6 feet away, but if that expectation is set from the get-go, it's a little bit easier. As a reminder, beginning Wednesday, we will conduct our COVID-19 testing at the Jacob Building in Shohowee Park from 9 a.m. to 3 p.m. You do not need to make an appointment. Testing is at no cost to the individual. However, if you are insured, please bring your card so we can collect your insurance information for the lab to bill your insurance. There may be a couple of days where we have to conduct our testing at another location, but when that happens, we'll be sure to let you know, make a public notification. As a reminder, if you get tested, you need to quarantine until your results come back. However, regardless if you've been tested or have symptoms, we all need to be following the 5 core actions. As we've said before, testing is not prevention. The 5 core actions are prevention. Please continue to implement these in your everyday life. We cannot let our foot off the gas. Just because we want it to be over doesn't mean that it is. This virus is still very present in our community, and the only way we can slow it down is by working together and all doing our part. And now we'll move into the local situation. Since March, we have had 4,111 confirmed cases of COVID-19 in Knox County. Additionally, we have 131 probable cases. 1,947 of our cases have recovered, giving us 2,256 active cases. We have 114 new cases since yesterday's report. 196 individuals have been hospitalized at some point in their illness, and 31 Knox County residents are currently hospitalized. And we are saddened to report an additional death due to COVID-19, bringing our total to 39. Our thoughts and prayers are with the loved ones of these individuals. And now I'll open it up for questions.
All right, please go ahead and type your questions into the chat feature, and please remember to type your name and the media outlet and which you're affiliated with. From Paul with WBIR, we are already hearing from some bars that they do not plan to close. Who will enforce the Board of Health's order in this situation? What will that process look like?
So there's several places that can be related to that and involved in the enforcement piece. So we'll be working very closely with our environmental health division here and the city of Knoxville and their codes and enforcement folks, as well as some others. And what we always do, and the plan is always going to be, first step is to make sure that we start with education. We never go in outside of COVID if we're having an issue with an outbreak in a facility or a restaurant or a bar or anything like that. We never go straight into strict enforcement. So at first we're going to be doing education for those folks and explaining what it looks like and what that needs to what needs to occur with that. And then after that, if there's still concerns and challenges and insistence to stay open, then we'll follow our normal processes that we follow. It's kind of outlined in the order, if you look at that, to follow up with those businesses and follow all of our normal public health processes we can do for organizations. We've talked about those a lot before, I think.
Paul's follow-up question was, are you relying on tips from the public or monitoring specific locations?
Mostly, probably a little bit of both, but we will follow up with complaints that we get and investigate those as we move forward.
And I see, Jamie, you have your hand raised. If you want to go ahead and type your questions into that chat feature, we'll be happy to ask your questions out loud. Let's see, the next question that's typed in is from Megan with WVLT. Can you talk about the evidence that contributed to the decision to issue the ordinance to close bars?
Well, I think there was a lot of national discussions that were happening with that. The White House Task Force, that was one of the recommendations from that, looking at areas across the country where more cases were being seen. And it's basically looking at the risk in those situations. So close contacts, you know, it's hard to wear a mask when you're drinking and in close proximity to people and all of the things that go along with that. So that was really where a lot of the discussion points came from, and making those recommendations based on those areas and the numbers of young people that we're seeing increased cases with. That was probably one of the factors as well, and that's happening across the country also.
Let's see. Alan asks, Charity just reported 114 new cases, but the bar graph shows 104, which is correct. We can go and confirm.
Yeah, we'll double check. I thought when I actually looked at it myself, it said 114. So we'll double check that.
From Laura with WATE, when it comes to the mask mandate, how many enforcement actions have been conducted in this last week?
I do not have any of that direct information in front of me. We'll have to follow up with you on that and get back to you.
From Paul with WBIR, how is it determined whether a business gets more than 50% of its revenue from alcohol?
That'll be a discussion that the folks that are doing the investigation and talking with the businesses have, and they have ways that they can provide that information. I'll be honest, I don't work on the enforcement side, so I can't give you all of the details on that, but I do know that'll be part of the discussion with the businesses when they're talking with them.
From Laura with WATE, can you give any details on the newly reported death?
Today's was a 69-year-old man. And do I need to go ahead and do the over the weekend? Saturday, we had 2 additional deaths since we reported Friday. One was a 66-year-old man, one was a 51-year-old man. And then Sunday reported out 3 deaths, an 81-year-old woman, a 78-year-old woman, and a 55-year-old man.
From Brian Hornback, is the executive meeting still happening today about the lawsuit? I do understand that media and public have no access to this meeting.
I'm not on the board, but as far as I know, it is still happening today.
From Megan with WBLT, why has there been no formal public announcement of Wednesday's public forum?
I believe that the information was released via Mayor Jacobs' office this morning via a media advisory.
From Paul with WBIR, the state says contact sports and TSSAA can start practice today. Is this a good idea? And how can players in contact sports realistically stop the spread?
You know, it's very challenging. We do ask that everybody follow the guidance put forth by TSSAA and all of our local recommendations to implement the 5 core actions whenever they are out in public, and making sure that when they're not there, that they're doing it you know, outside of football and everywhere else they can. But, you know, we also ask that the families are making the best decisions that they can for their children moving forward as well, and for their families. And so making sure that everybody's aware of the risk and the concerns and implementing those actions as much as they can moving forward.
From Claire with WUOT, can you give any details about the child who is currently hospitalized with COVID?
I cannot. We don't speak on any specific individual cases.
From Vincent with the Sentinel, so far the Knox County Health Department has declined to comment on the number or circumstances of COVID-19 clusters. Could you explain why?
Well, as we said from the beginning, we don't talk about clusters or individual cases unless there's a reason to do so. That we have not been able to reach out to the people that have been identified as close contacts. And again, a close contact is somebody that was around a potentially infectious person for less than 6 feet for more than 10 minutes is the definition that we use. And so far we've been able to do that. And when we can't do that, we will make announcements if we need to.
From Megan with WBLT, have any clusters been connected to any Knoxville bars, restaurants, or other businesses?
We've had cases associated with lots of businesses, including restaurants and bars, but typically that is not a place where we're seeing at this point. We haven't had clusters where the public was impacted. Typically, it would be either employees, maybe just like it could be anywhere else, and there's been some cases that way, And we have had people provide us say that they've been to a restaurant or a bar or any other myriad of places, but not any clusters identified around this, or where we're having a lot of different people identify that. Now, to qualify that, our information is as good as the information that we get from the individuals that we talk to, so from those cases. And we know that, and that's where we also look at the age demographics of where we're seeing spread and kind of general behavior that we're seeing and things that they're telling us when we look at the full picture of what we're concerned about at this point. So it's definitely, those things are high risk activities, but no specific clusters or anything at this point.
From Claire with WUOT, do you believe yesterday's lower case count is representative of the days KCHD wasn't testing last week, or an actual drop in new cases?
I think it also could just be a blip of when we got lab reports in. It's really hard to know and base anything on one data point on one day. It could be but as we've said before, our testing volume is a fraction of what's happening across the community. And so there's a lot of things that could play into that. So if we continue to see a downward trend, that will be promising. But again, we don't put a whole lot of stock into one day and one data point.
From Jamie with the Sentinel, what is the Knox County Health Department doing in response to 3 cases in the Knox County Public Defender's Office?
Just like I just previously mentioned, we don't talk about specific cases or clusters. I can tell you in general, what we do for businesses and cases is we interview those cases and we find out, again, who's been in close contact, whether they've even been at work during their infectious periods. A lot of times it's not, and people get a little confused about that. And they haven't even been there sometimes. And then from there, we reach out to all of the close contacts that could have potentially been in contact with those cases and let them know that they need to quarantine and all of the things that go along with that. That's following CDC and state guidance on all of these things in our normal operations.
From Vincent with the Sentinel, is a global pandemic of a highly contagious disease not enough of a reason to outline what context you are seeing clusters?
At this point, no. I mean, everybody, we're again trying to protect individuals and businesses' privacy when they're doing everything that they're supposed to do. This is a common practice that we have. There's community spread happening everywhere. So it's really hard to 100% nail down a location. And following the trends and the guidance of what we're seeing from other public health jurisdictions across the state and the country, this is the information we feel comfortable providing at this time.
Also from Vincent with the Sentinel, you said that your contact tracing team is capable of tracing all of a case's close contacts within 48 hours of a case report. Has this changed?
At this point, no. Our team's expanded. We're also utilizing the state. There's a central office team at the state that can help with that. We've talked about that before. That has a lot of resources associated with it that can help do some of the monitoring and contact tracing. So at this time, we are still able to reach out to the people the information that we've received from the individual cases.
From Megan with WBLT, why was there no public notice of today's executive session with the Board of Health?
They mentioned it Wednesday night during the Board of Health meeting, and that is a closed session because my understanding, and again, I can't provide all the details, but it's because it's based on they're discussing a lawsuit. And so that has to be a closed session so they can talk with their legal counsel. So questions for that could go to the board.
Vincent with the Sentinel, context does not imply naming individual businesses or locations.
Oh, okay, I misunderstood.
Would the Knox County Health Department be willing to provide general anonymized cluster information?
Yeah, I don't know for certain. We'll go back and look at that and talk about what kind of data that we can provide. I can tell you what we've been telling you is, and Vincent, I think that's a good question, and we'll look at that. But a lot of what we're seeing in clusters, and I know it sounds like beating a dead horse, but a lot of it is that kind of getting comfortable with people and letting your guard down. And so we're hearing and talking with people that have been attending birthday parties and backyard barbecues, or they're in their workplace and they've gotten comfortable with the 5 people they're around all day, every day, and they're not following all the 5 core actions there. There's a lot of different things, and that's what we're seeing a lot of. And I think you're hearing more. I heard some news articles this weekend on the same, or some news coverage this weekend with folks saying the same thing. It's that getting comfortable and letting down our guard and not following those 5 core actions everywhere we are. And that's what's really important. And that's really, truly, honestly, where we're seeing the most of our, what we would call clusters.
All right, any other questions? Please go ahead and type them into the chat feature. From Megan with WVLT, can you tell us more about the reported deaths? Were those who died in the hospital for an extended time with the virus before they died?
There's always a mixture. Somebody, whether they were hospitalized or not, I don't have the exact details at this time. Sometimes it has been somebody that's been hospitalized, and we've had cases where individuals have unfortunately died at home, whether they've been seeking care or not. There's a lot more detail to that we can't release.
All right, any other questions? Please go ahead and type it into the chat feature now. Megan, I see that you said to clarify a previous answer. I'm not sure if you had something coming after that. Okay, to clarify a previous answer from Megan with WVLT, no cases of customers have been connected to bars.
I'm not aware of, and again, we're not going to go into a lot of detail here, but I'm not aware of, we've had cases mention that they have been in bars, yes, or restaurants or whatnot. We're not seeing that there's a single bar cluster that's been identified at a certain location at this point in time. And we're not seeing clusters with cases that identify the same location, if that makes sense. So there's across the board, the same person might say they've been to a bar, into a restaurant, into the gym, into work, and all of those things. And there's not a single converging point that we've identified at this point. Hopefully that makes it a little more clear.
From Jamie with the Sentinel, does the Knox County Health Department have any enforcement power to ensure that Knox County public office holders are properly sanitizing taxpayer-owned offices and buildings?
I am not aware of all of the plans and policies they have in place in all of the buildings. We've been recommending that they follow the Tennessee Department of Health and the CDC guidance on disinfecting. And I know that in the Tennessee Pledge, all of those things on what public buildings should be doing. But I think that would be a good answer or good questions from them as far as our authority. If there was outbreaks in those areas, that there was something along those lines, poor infection control principles or something like that weren't being implemented, we could follow up with that. But I would suggest we direct those questions to the specific offices.
And then Alan, I see you have a question for clarification on today's case increase, and we will get you that shortly after the media briefing. We'll go back and clarify that. And then, so Vincent clarified from Jamie's question, saying including the public defender's office in regards to taxpayer-owned offices.
Yeah.
All right. Any other questions? Please go ahead and type them in now. All right, not seeing any other questions come in. So thank you all for joining us. And we will see you again on Wednesday. Have a good and safe rest of your day.